Hello, my name is Daniel Mendiola, and I'll be presenting my research poster that's based off of the article titled Effects of the High Intensity Early Mobilization on Long-Term Functional Status of Patients with Mechanical Ventilation in the Intensive Care Unit. The introduction of this article can be briefly summarized as intensive care unit associated weakness is associated with a risk of prolonged hospitalization, impaired recovery, and even death. Several guidelines and expert consensus indicate it is safe and feasible to initiate early activity in patients receiving invasive mechanical ventilation, or IMV. It is necessary to understand the impact that early activities have on physical function post-discharge. The research question that was posed goes as follows. The aim was to investigate whether high-intensity early mobilization improves a patient's functional status compared to conventional treatment at 3 months of ICU discharge. Next, we'll cover the methods. There were 6 methods that were given to us. Number 1 was a study design, which was just a randomized controlled trial that tried to investigate the effects of high-intensity early mobilization on patients' functional status. Talks about the consent that was obtained from all participants or their responsible family members, how they gathered the ethical approval, how they used a consort checklist that was used to guide reporting the research data. Then we have the settings and participants. Eligible participants had to be 18 years or older and were expected to be on mechanical ventilation for more than 24 hours at the time of screening. Other patients that were also included were patients that had an independent functional status with a Barthel index of 100 points. The Barthel index itself was determined based off of interviewing patients' family members. Patients that were excluded had one of 6 reasons. Either they were cognitively impaired, which means that they didn't have the ability to understand commands or didn't have control of their mobility. The second reason was they had contraindications for mobilization, such as an unstable blood pressure. Number 3, patient had a death within 48 hours of admission to the ICU for this study. Number 4, the patient had an ICU admission for the second time in the last month. Number 5, mechanical ventilation time was greater than 48 hours outside of the hospital before this ICU admission for the study. And the 6th reason why they would be excluded was that the patient had lower limb mobility disorder. Next, we'll be going over the outcomes. There were either a primary outcome or a secondary outcome. Primary outcome was to get the patient's functional status, which was determined by the Barthel index score after ICU discharge. The Barthel index score followed up 3 months after the ICU discharged, and those were divided into 2 groups, which was based off of the index score. Either you had to be greater than or equal to 85 points or less than 85 points. The secondary outcomes included only 2 groups: the capacity of mobility and muscle strength. Capacity of mobility was assessed by the PERMI score and the ICU mobility scale that were collected at the time of ICU discharge, and muscle strength was evaluated by Medical Research Council SUM score, which was determined during the enrollment and discharge from ICU. The other secondary outcomes that also were determined during this, or that were recorded during this research, was the ICU length of stay, ICU mortality rate, 3-month mortality follow-up, incidence of complication, and invasive mechanical ventilation duration were also recorded. One last one that they also did was the delirium, which was assessed 3 times daily. Next, we have number 5, sample size. This one gets pretty technical, but basically it's talking about a software that they used called G-Power, which was used to calculate the number of subjects. And then number 6, we have the statistical analysis. They basically talk about general data that was expressed as either mean and standard deviation, percentage, or median. It was used as a comparison of intensity of physiotherapy, functionality status, length of stay in ICU, duration of mechanical ventilation between groups, and it also goes over how the researchers were able to conduct their data by using student t-test or Mann-Whitney non-parametric tests. The difference of mortality, delirium, ventilator-associated pneumonia, venous thrombosis, ICU-associated weakness rate were all compared using something called a chi-square test as well. And that all falls under the statistical analysis, which is part of Now I'll be going over the clinical significance and results together. We had the primary outcome analysis result, which is number 1. Of the 132 participants that were enrolled, there was only 2 deaths in the intervention group and 9 deaths in the control group at the time of ICU discharge. Therefore, only 121 patients were included in the data analysis in total. For the intervention group patients, it was determined that they had a higher functional independence than the control group. The second result, which was the secondary outcome comparison between 2 groups, number 2, the clinical significance is that the control group accounted for 50% of levels 1 and 2, while the intervention group greatly populated the 4th and 5th levels. These levels are actually part of the high-intensity early mobility program, where each morning the research team assessed patients and set target activity level for the day. These levels went from 1, 2, 3, 4, and 5. The first level was passive activity. Level 2 was sitting up in bed and responsive to instruction with a muscle strength less than or equal to 2. Level 3 was sitting in a chair and responsive to instruction with a muscle strength greater than or equal to 3. Level 4 was standing, and level 5 was ambulation. There was a significant difference in mean intensity of physiotherapy received between the 2 groups. ICU-associated weakness was far lower in the intervention group patients, and then there was no significant difference in terms of duration of mechanical ventilation, ICU length of stay, venous thrombosis, ventilator-associated pneumonia, and the 3-month mortality. Now I'm going to cover the discussion/interpretation. The study's aim was to investigate whether high-intensity early mobilization improves the patient's functional status compared to conventional treatment at 3 months of ICU discharge. It found that the early implementation of mobilization was one of the key factors for success, as the article ended up stating. It also found that early mobilization within 7 days of admission improves physical function, functional status, and walking ability compared to late mobilization. Limitations of this study that were found were these 3. The first one was the functional recovery measurement of alive, I'm assuming, patients at the time of ICU discharge was limited to the Barthel Index scores, while the indicators of return to work, cognitive function, and health-related quality of life were not included in the recovery measurement. So it was only limited to the Barthel Index score. The second limitation was stated to be patients in the control group have a higher mortality rate before ICU discharge, which may have led to information bias in the analysis of patients who died before ICU discharge were included in the intention to treat analysis. The third limitation was that only the maximum intensity of early mobility achieved by patients was recorded and not the total duration of activity time. Now I'll go over the conclusions. The study determined that high-intensity early mobilization in patients with invasive mechanical ventilation had positive outcomes for the patients within the intervention group at 3 months post-ICU discharge. Other positive outcomes were improved capacity of mobility and muscle strength, decreased incidence of ICU-associated weakness, decreased delirium, and a decrease in mortality during the ICU stay. The other conclusion that was determined was for patients that have ICU-associated weakness in the ICU or post-ICU discharge, it's suggested that active and passive activities should be carried out as early as possible during the ICU stay. Lastly, we have the references, which are down below on the bottom right corner with a blue hyperlink to the actual research study. And that should be it. Thank you very much.